Welcome to Original Medicare Part A, presented by OneSource Financial Advisors. In this short video, you'll learn how Medicare began, along with what Medicare Part A covers and the potential costs associated with it, such as monthly premiums, co-pays, and deductibles. Under the leadership of President Lyndon Johnson in 1965, Congress enacted Medicare under Title 18 of the Social Security Act. Although it is a government-sponsored program, Medicare insurance is not free. Part A is funded at least in part through payroll taxes, but more on that later. So who really qualifies? In general, any person over the age of 65 who has been a permanent legal resident of the United States for at least 5 years may qualify, and certain disabled individuals younger than 65 may also qualify if they have been receiving Social Security SSDI or Railroad Retirement Board disability benefits for at least 24 months, or have end-stage renal failure. Now that we know the basics, let's get into the specifics. Although most Medicare beneficiaries don't pay a monthly premium for Part A, it does require at least 40 quarters or 10 years of payroll tax payments by either the beneficiary or their spouse if married. If that requirement is not met, the monthly premium could be as high as $422 per month. Once coverage is in place, Part A helps cover the cost of inpatient hospital stays, skilled nursing, hospice, and some home health care, but all with limitations. For inpatient hospital care, there is a $1,340 deductible for the first 60 days of care, and it's important to know that deductible is reset every 60 days for patients who are readmitted, meaning a truly unlucky individual could encounter that deductible 6 times per year. The reality is, though, most people will never experience the extremes of Part A's deductibles and copays, but it's important to know how they work. If a patient is still receiving inpatient care after the initial 60 days, there is a $355 per day copay for days 61 through 90. If a patient is still receiving inpatient care after 90 days, Medicare offers a maximum of 60 one-time use lifetime reserve days, during which Medicare will still subsidize inpatient care, but the patient's copay is $670 per day. After that, the patient is responsible for 100% of their inpatient costs. That's one of the reasons so many retirees seek alternative insurance options through Medicare Advantage or Medicare supplements. Although Medicare does help pay for some skilled nursing expenses, the coverage is very restricted. It covers semi-private room and board for skilled nursing and rehabilitative care, not convalescent or long-term care. Medicare requires a 3-day minimum medically necessary hospital stay, not including the discharge day, and also requires physician certification for skilled care, such as a need for intravenous injections or physical therapy. If a patient meets the mandatory criteria, Medicare pays 100% for the first 20 days of skilled care and subsidizes another 80 days with a patient copay of $167.50 per day. After 100 days, the patient is responsible for 100% of their skilled nursing expenses. Hospice care, on the other hand, is covered 100% by Medicare, but it's reserved for individuals diagnosed by a physician as terminally ill and expected to expire in 6 months or less. For individuals who are homebound, meaning they need assistance leaving the house or due to their illness leaving the house is not recommended, Medicare will pay for home health care. But the patient may still be responsible for certain expenses such as a 20% copay for Medicare-approved physician services and the Part B deductible for Medicare-covered medical equipment. Phew! I know that's a lot of information, but it's important to know how your Medicare coverage works and your potential exposure in Medicare's cost-sharing arrangement with the American people. To explore what Part B covers, along with its associated copays and deductibles, please click the link for Part 2 of this original Medicare series. You may also want to view our videos regarding Medicare Advantage, prescription drug plans, or Medicare supplements. Thank you for watching. If you have specific questions concerning Medicare, Social Security, or anything else related to a successful retirement, please call OneSource Financial Advisors at 520-686-7783 or email us at admin@finance.onesource.cloud.